Hey there, I'm Dr. Ruth Roberts, your pet's ally. Hope that you are well. And Hayo is here helping me, so she's going to be a little buffy for a minute. I hope that everybody is doing well. And Sri, I want to say first off, we're so sorry to hear about Cece. It is always so hard when you lose a pet, and there's just not anything that makes that easier as time goes on. But as you say, she lived to be 14 and a half, and they were glorious years, so we can take thanks in that. So let me jump into the questions that you guys have today, and you got some great ones as always. So Kay is asking about her pup that had surgery, had a fatty tumor removed, and then yeah, it sounds like it filled up with fluid, and they had to go back and put drain tubes in and all of that good stuff. And that's great that they've at least got some Yunnan Baiyao on board, because that helps with the bleeding. It also actually helps with pain too, which is great. And you're also using some topical Topricin, which I hadn't heard of, but it's essentially a variation on an arnica formula with a few other things in there as well, and some other things that are supposed to help. So I'm not sure if you're using this product in specific, but it's a good one. So what else can we do to help him heal and detox? And what I would say is you need to look at getting through kind of what's going on. And what's going on is you've got some pain medications on board that are helping help him stay comfortable. And yes, you do need to help with the liver, because they're going to create some issues as far as the carprofen and the tramadol. So, you can do a super simple thing, which is milk thistle. And Kay, I'm sorry, I can't remember how much your baby weighs, but if it's a poodle, fairly tiny. So something on the order of about 75 milligrams of milk thistle daily. I'd use that along with the medications, and then for another 2 weeks afterwards. And then the other thing you will want to do, because once everything is healed up, is start doing passive range of motion, movement, stretching, massage over the area, because my concern is that that area can kind of stricture down and scar down, which we want to some degree, but not to the point where it ends up limiting movement, because that's kind of the reason that you got the surgery done in the first place, because this thing was in the way. And unfortunately, where it is, it's a common problem post-surgery. And if this thing was like this size on a 6 or 10 pound dog, that's a big space to fill, and that just happens with time. So using wraps over that to keep everything compressed, that will help. And then what you're using currently with the arnica, that will help with pain. You could consider also using laser once everything is healed up. But for right now, it's not a great idea. The other thing you can do as well is use Epsom salt compresses. So obviously, while the wound is still fresh and the incision lines are healing, you don't want to use something super wet, but you can use like a fairly damp compress at a little bit more than tepid temperature to help remove some of the swelling and pull the gross stuff out through the skin. So that's another detox method we often forget about. So okay, that's kind of where I would start, but really I think you're in good shape, and most of the detox is going to be helping the liver get rid of the garbage. The other thing I would certainly do too is that anytime you take an NSAID, you're whacking the gut microbiome, so I would definitely go back on probiotics on a full daily dose for a month until everything sort of settles back out, and then you can titrate back down. So I hope that is helpful, and I hope that everything goes better as far as getting healed up. And let's see, let me pop back over to Facebook. And Willie, unfortunately, not doing so great. And I'm so sorry, Jamie. So I think this picture says it all. You've got a couple of things going on here. So here's the facial nerve paralysis. Everything is droopy. This side he can hold up, this side he can't. The other thing I saw in the photo, so this is the left side, he's got significant muscle wasting here. And I don't know if he's experiencing any pain when he is chewing, but this might be like a MMM, masticatory muscle myositis, which is kind of a quasi-autoimmune thing. Same thing up here, muscle wasting here. So there's just not much to protect the trigeminal nerve, which is what is causing this for facial paralysis. This can kind of come and go because Willie has a lot of stuff going on. I'm afraid it's going to kind of stick with him to the end, on the way out. So I hope you get more information from the neurologist, but my guess is that they're going to say there's not much to do about this. Yeah, and I think that's the venerelbine is probably what it is, or it could, again, like you said, I mean, there's a whole host of things that could be going on here, which really sucks. The prednisone, I can't remember if you're on pred or not, but that may be helpful too, as far as reducing whatever process is creating the inflammation. And Susan, good to see you. I'm sorry to hear about Abner. That's weird. So he's been trembling lately with 1 day of loss of coordination, and that's not good. I know because you've been fighting with all sorts of stuff with him, the lymphangiectasia primarily. So Susan, I'm not sure what to tell you. This is really when you need to get a set of hands on, and happy to help kind of once you get a little bit more information. But if there's a loss of coordination, that's generally either vestibular disease or sadly centrally mediated disease, so meaning something going on in the brain itself. And we call it old dog vestibular syndrome. You can try meclizine, which you can buy as Bonine over the counter, and it's usually a 25 milligram tablet. You can try, I think for his size, a quarter tablet twice daily or up to 3 times daily to see if that helps. If he's like night and day better in about 24 to 48 hours, then that's, oh, I'm so sorry. So I'm guessing you've already tried the ER route. If you've went to the ER last week, and that's so frustrating. So Susan, did they already give you a trial of meclizine or just kind of sent you back into the woods? And Jamie, he says Willie is on pred, and the wasting showed up a couple of weeks ago in 2 of the first treatment in prednisone. Yeah. So, yeah, that sinks. It makes me wonder more about an autoimmune type thing. Like, he probably doesn't have any pain chewing. Willie doesn't have any pain chewing, does he, Jamie? Because that's really a highlight of MMM. So meclizine or Bonine is that. I just dropped that spelling into the comments. So Susan, what did the ER doc tell you? And kind of while I'm waiting for you to get some comments back in, I will pop over to the last question, which Sri asked about monofeeding. And again, we're so sorry to hear about CC Sri. Monofeeding, I think, is one of those things that that stinks. So Susan says they gave him a shot of painkillers and muscle relaxants that really messed him up. Yeah, so Susan, try the meclizine in the meantime. If you've got an appointment Wednesday, you'll have an answer as to whether that's helpful or not, and then that will get you some information. You can tell your doctor on Wednesday. Yeah, and Jamie, if Willie is chewing and eating with gusto, it's definitely not MMM. So it sounds like more like a trigeminal nerve neuropathy, for lack of a better description. Yeah, sorry, Susan. Really hate this. So back to Sri's question about mono feeding. I don't think this is a good idea long term. And I mean, the way you're planning to do it is to, Hi-oh, stop. So our vicious attack dog is trying to attack Mary Jo with a vacuum. The way you're planning to do it is to rotate through foods on a routine basis. The idea, I think, kind of comes from a lot of different fasting regimens, from Ayurvedic medicine on through whatnot. And the idea is to give the gut a rest. I don't think this is a good long-term strategy for a healthy dog. And so if we go over to this link, and this is more on the human side, obviously, but the idea is to give the gut some super simple foods to eat, so that when you are in this process of detoxing, your body doesn't have to really work hard. And, I think that that's a reasonable thing to do from time to time. Some of this stuff, I don't know, ghee gets promoted as, the really good stuff. But butyric acid is indeed helpful for the microbes and things of that nature. But it's, I think the thing with food is that we tend to make these decisions about food based on kind of whatever the flavor of the month diet is. And a lot of it is figuring out what works for that individual person or that individual animal. And I think that what is better is to have periods of fasting. So maybe you have a day where they just don't eat all day, or they just don't eat breakfast. So they just have a light supper in the evening. So that's a strategy that's been recommended. And that's a good thing, to let the gut rest periodically. Meat is difficult to digest. However, these guys are omnivores, and so I think it's important to have that in their diet, at least partially. So what I would suggest doing is keeping, your other two dogs, and I think and I'm sorry, I can't remember if it was two other dogs or one other dog, but since that dog is relatively healthy, what I would do is continue to offer a wide variety of foods in balance, and maybe have a day of fasting. Or maybe have 2 or 3 days of fasting, or have 2 or 3 days where you just feed rice, or you feed the mung bean and rice mixture, just to help kind of let the gut rest for a little bit. I think there's absolutely nothing wrong with that. But if we start mono feeding specific foods so that the gut does one thing or another, then we're going to train the gut to be out of balance. And that's kind of what my objection to this would be. Most of the other sites I found, and I think there is a group that Christine Chambreau is part of, recommends mono feeding. And I think the jury is still out on it. But honestly, I'm not sure that it's a great sort of lifelong program. What is probably better is to look at what is in season and feed that instead of feeding tomatoes in January, which is not, unless you live in a tropical climate, that's just not a normal thing to have. But dark leafy greens, butternut squashes, things of that nature is. So we get used to being able to feed kind of whatever we would like when we go to the grocery store in the U.S., and we really have no idea for the most part what's still in season. But I think that wisdom of all of the ancient traditions of medicine is a valid one. So that's my sort of rambling answer, but the short, concise version is feed in season if you can figure out what seasonal vegetables are for your area, and have maybe a day of rest at least once a week, or maybe once a quarter. There's the idea of the fasting mimicking diet, where you feed really, really simple foods and lower calories for about 5 days. And while you're not truly fasting, you are reducing the effort of the gut significantly so that your body can go through and produce the same benefits of fasting. So I hope that's helpful. And then Susan was asking if meclizine will make him sleepy, and sometimes yes, but often no. I think they sleep because finally things aren't out of whack in their brains. With vestibular syndrome, when it's one side or the other, you'll see a head tilt, and usually you'll see nystagmus in the eyes. So, and either back and forth or rotary, which is typically more indicative of the central disease. But it's sometimes, if we have both of the cochlea affected with vestibular syndrome, you won't see any nystagmus because they're both sides are equally out of whack, for lack of a better description. So sometimes when they take meclizine, we'll see them sleep just because they're feeling so happy to not be fighting the dizziness constantly. And Jamie said he's only had one day where he's been disinterested in eating, so that's great. It was right after that first Venerelbine diagnosis. Oh, good. And if you are seeing more movement of the eyebrow, that's great, because that means that innervation is coming back. And this is the thing that's so tricky about Bell's palsy. It can be there, and then 3 days later it can be gone. It can be there for months, and then all of a sudden it goes away. So it has a really weird kind of shifting appearance to it. Yeah. Yeah, and I know it's been a long time since he's had these skin issues show up, Jamie, so I hope that you are getting some help, and the THC is helping a bit as well. Yeah, and Susan says it seems that both sides are out of whack. So let me just double check and make sure I have gotten all the questions answered for today, and I think that I have. So that's what I've got. I mentioned on the in the Crockpet broadcast that we have the turmeric at buy one get this 50% off the second jar, and that's going on for a bit. The other thing that's really super exciting is that Standard Process has actually gotten given me permission to sell their products directly through the store. So we're still continuing to work through the legal process, but we should have that good to go here within this week. And then lastly, all of you that are Ipets Ally members should have gotten an email from Hannah that says, welcome to Ipets Ultimate. And the broadcast I talked about about CBD, we're actually doing tomorrow, and I believe that is at 4 Mountain, and we'll be sending you an invite out about that. That's going to be a Zoom broadcast, so it's a little bit different. It's a lot more interactive, so what I'll do is go ahead and go through the presentation, take some questions on that. If you've got some additional questions on your pets, we'll be happy to answer them as well. But it's a lot more informal, and it's truly more of a hangout session than and an opportunity to get you some new information. So we will get you that. That should also have gotten you access to the Ipets Ultimate recordings that are in the members area too. So that is what I have for this week, and it's Susan says yes, and I'm doing this because you guys have been my faithful followers, and you've really helped me stay in business and grow, and I appreciate that deeply. And if you, having said that, if you can take the time to do a testimonial for us on video, that would be of tremendous help. Bettina was kind enough to do that. Yeah, and Jamie will. The other thing is that you should be able to renew at whatever price you came in on. So when you, that's through our subscription service Recharge, so you probably got that. I think you can probably click the link. You should be renewing at whatever price you came in on, but $24.95 a month or less. So if you've got any questions about that, as always, email Hannah, and she will get you helped out with that. Sorry, I've got half of... Yeah, Susan, if you can do it on video, that would be absolutely awesome. And that's kind of unnerving for many of you, but it just helps. I mean, when you see video testimonials of somebody that's had a great experience with their pet for other products, other services, it makes it a little more real. You're not just taking my word for it that it's the best thing in the universe. You know, you're taking other pet owners that have been in your shoes. So that's what I got for you today, ladies. And actually I will be taking next week off. We're traveling back to the U.S. So the next time I talk with you, I will be on Eastern time for about 3 weeks, and then we'll head back to the mountains and be back on mountain time. Until then, take good care, and remember, your pet's best health starts in the bowl. Thanks. I'm Dr. Ruth Roberts, your pet's ally.